If you've been living with a persistent ringing, buzzing, or hissing in your ears, I want you to stay with me for the next few minutes because what I'm about to share could genuinely change the way you think about this condition. And I want you to try something for the next 7 days. Something simple, something most people have never been told to try. So many people ask the same question. Will this noise ever stop? Is it something I have to carry for the rest of my life? Is there truly nothing that can be done? They sit across from a specialist. They describe the sound in their head, and far too often they're told that the cause simply isn't known. Today I want to walk you through a different way of understanding this, something that rarely gets discussed in a typical appointment. Here's the first thing you need to understand. That ringing sensation doesn't actually originate inside the ear canal itself. Now, it's absolutely true that this kind of phantom sound can follow years of exposure to loud machinery, concerts, or a noisy workplace. It can also show up as a side effect of certain medications. But what about the people who've never worked around loud equipment, never blasted music through headphones for hours, never taken a drug known to affect hearing? What explains it for them? I started paying closer attention to something after reading through hundreds of comments left on health videos discussing this exact topic. A pattern kept surfacing again and again. People described trying different eating strategies, cutting back on processed carbohydrates, experimenting with extended overnight fasting windows, and noticing something surprising. The intensity of the noise in their ears began to fade. Some described going weeks between meals. Others simply stopped eating late in the evening and shortened their eating window during the day. Several mentioned cutting out sugar and refined starches almost entirely. And time and again, they reported the same thing, a gradual quieting of a sound that had followed them for months or even years. Others noticed the opposite. The moment they ate something sugary or drank a caffeinated beverage, the ringing spiked almost immediately. That pattern sent me down a completely different research path. I wanted to understand what connection, if any, exists between blood sugar regulation, insulin, and the delicate nerve tissue inside the inner ear. Here's something worth knowing before we go further. When someone undergoes a routine hearing evaluation, they're often told everything looks completely normal, even when it isn't. That's because a standard test is mostly designed to answer one narrow question. Can you detect a simple tone at a comfortable volume? But there are entire dimensions of hearing that a basic screening never touches, which means it's entirely possible to walk out of that appointment with a clean bill of health while real, measurable changes are quietly taking place. If you ever go in for testing, it's worth specifically requesting an extended high-frequency assessment and a speech and noise evaluation, since those are far more likely to reveal something a basic beep test would miss. Now let's talk about where this phantom sound is actually generated. It isn't manufactured somewhere in the ear canal. It originates in the brain itself. When a person experiences even subtle hearing loss, it typically happens at a very specific frequency range. In response, the brain appears to compensate for that missing input by generating its own signal, essentially turning up an internal amplifier to fill the silence where a particular pitch used to be. So what actually damages the delicate structures responsible for hearing in the first place? Certain medications, prolonged loud noise exposure, viral infections, and even some cancer treatments can all injure the tiny nerve fibers inside the inner ear. But there's another contributor that doesn't get nearly enough attention, and it may be the most overlooked of them all. Prolonged elevation in blood sugar gradually damages the microscopic blood vessels responsible for feeding those same delicate nerves. This connects directly to something many people already recognize under a different name, a diabetic complication called peripheral neuropathy, the tingling, numbness, and burning sensation that develops in the feet and hands after years of poorly controlled blood sugar. Here's the part most people never realize. The nerve pathways that extend down into the feet share the same underlying wiring as the nerves inside the inner ear. They're both peripheral nerves, vulnerable to the exact same metabolic stress. And here's why so many people go years, sometimes decades, without any obvious warning sign. Standard blood glucose can look perfectly normal for a very long time because insulin is working overtime behind the scenes to clear sugar from the bloodstream almost as fast as it enters. That's why someone can have completely unremarkable glucose readings for 10, 15, even 25 years before any symptom shows up. But that insulin isn't free of consequence. Chronically elevated insulin levels place direct stress on nerve tissue. And over time, that same insulin resistance starts to choke off the fuel supply that peripheral nerves depend on to function. What makes the inner ear especially vulnerable is that its nerve tissue has an unusually high metabolic demand. It needs a steady, uninterrupted supply of energy to function properly, which means it's often among the first structures to suffer when that fuel supply becomes unreliable. Researchers have been exploring this connection for some time. Some studies looking specifically at people with unexplained tinnitus have found a striking overlap with elevated insulin levels. Other research has pointed toward a meaningful overlap between tinnitus and early, undiagnosed blood sugar dysregulation. Larger population studies tracking metabolic health over time have similarly noted that people managing diabetes report ringing in the ears more frequently than those without the condition, and that higher intake of sugar-sweetened beverages tends to track alongside a greater likelihood of experiencing the symptom. None of this proves a single, simple cause, but taken together, it paints a picture worth paying attention to. This is very likely why fasting and low-carbohydrate approaches seem to help so many people. Reducing the frequency and size of carbohydrate-heavy meals naturally brings insulin output down. And as insulin production settles, it appears the constant strain on those tiny nerve-feeding vessels begins to ease as well. If you do go in for blood work, don't stop at a basic glucose panel. Ask specifically for a fasting insulin measurement. Generally speaking, keeping that number on the lower end of the normal range is considered a favorable sign for long-term metabolic health. And this is a conversation worth having directly with your own physician, since ideal targets can vary from person to person. If your results come back and you're told everything is fine while your fasting insulin sits well above what's typically considered optimal, it's reasonable to ask more questions rather than simply accepting a passing grade. Reducing processed carbohydrates and giving your body extended breaks between meals appears to lower that circulating insulin level. And as that happens, more consistent fuel becomes available to the small vessels feeding the auditory nerves. This is also why I don't believe hearing decline and phantom ringing come down to a single missing vitamin or mineral. Nutrient status plays a role, certainly, but there's a broader metabolic picture at work that deserves just as much attention. With that said, there are two nutrients worth discussing with your healthcare provider that have shown some promise in supporting nerve health. The first is alpha-lipoic acid, a potent antioxidant that helps neutralize oxidative damage throughout the body. Some research has explored its use over the course of a couple of months and noted a meaningful reduction in the intensity of tinnitus symptoms. The second is benfotiamine, a fat-soluble form of thiamine that has a long history of use in supporting nerve health, particularly in the context of peripheral neuropathy. In my experience, when it's paired with meaningful dietary change, the improvement tends to be more noticeable and longer-lasting. Used on its own, without addressing the underlying metabolic driver, the benefit tends to be modest and often fades. As with any supplement, dosing should be discussed with your own doctor, especially if you're managing another health condition or taking other medications. How quickly you notice a difference will depend on how long you've been dealing with this and how much underlying nerve stress has accumulated over time. If there's been extensive damage, meaningful change won't happen overnight, and that's simply the nature of nerve tissue healing. That said, many people who commit to this approach begin noticing some shift within the first week. Here's a simple way to track it. Right now, rate the intensity of the ringing on a scale from 1 to 10 and write it down. Then check in with yourself each day for the next week and rate it again, so you can actually watch the trend rather than relying on memory alone. If a full week passes without much change, don't assume this approach isn't working. Nerve tissue often needs more time than we'd like, so give it several weeks before drawing any conclusions. It's also worth understanding why this symptom often feels more noticeable at night. As you reduce your carbohydrate intake throughout the day, your body is gradually pushed to draw on stored fat for energy, shifting toward producing ketones as an alternative fuel source. Many people report this transition brings noticeable relief even faster than expected, precisely because the nervous system finally has a steadier source of fuel to draw from. So, is this something you're destined to live with permanently? I don't believe that has to be the case for most people, but this requires patience. Give the approach a genuine 2 to 3 week trial, longer if you're able to, because the metabolic shift we're talking about doesn't happen in a single afternoon. Support your body with steady, consistent habits. Prioritize real, whole foods, protect your sleep, and give your nervous system the calm, stable internal environment it needs to repair itself. Healing rarely happens through a single fix. It happens when the entire internal environment shifts in a healthier direction, and the auditory nerves, like every other part of the body, respond to that change over time.